Hello everybody, welcome to Low Carb in the Leaves on this fine Tuesday morning. I wasn't doing this yesterday because I was away on holiday, which was extremely good for me and my mental health. So today, later on today actually, Lucy and I are giving a talk at Deakin University Medical School in Geelong to the second year university students about diet and lifestyle. I will be talking about diet and non-alcoholic fatty liver disease, and Lucy will be discussing diet and obesity. And it's extremely exciting. We are talking alongside lots of other wonderful doctors who use and advocate for a healthy low carbohydrate approach to treat metabolic disease. And I'm really looking forward to it. And I thought that today I would do a little recap on non-alcoholic fatty liver disease since it's so fresh in my mind. Non-alcoholic fatty liver disease is incredibly common. About 30% of Australians, just under 30%, it is estimated, have got fatty liver, non-alcoholic fatty liver, and don't actually necessarily even know it. It is a silent disease, but it is important to know whether or not you have got fatty liver because we've got a really safe and effective intervention. And fatty liver is dangerous. It's not a benign condition at all. It can cause liver inflammation and can, in some unlucky people, if it goes on and on and on, can cause scarring and inflammation of the liver that, if it's left untreated, can lead to cirrhosis, complete liver failure, the need for a liver transplant, and indeed death. It is the most commonly growing cause of needing a liver transplant in Australia. It's not the most common cause of needing a liver transplant, but it is the most commonly growing cause. It is the one that is growing the most. It also increases the risk of liver cancer, hepatocellular carcinoma, all of which have a huge burden on our country and indeed all westernised countries with our westernised diet. But also, if you've got fatty liver, it is a herald of metabolic syndrome, this cluster of syndromes: high blood pressure, high blood sugar, high insulin resistance, the atherogenic cholesterol profiles, the type of a lipid profile that is likely to either cause and or be associated with heart disease. All of these things are bad. And the reason why it's important to know about it is because if you learn that you've got a fatty liver, then you can treat it. And we have a really wonderful, safe and healthy treatment. There's pretty much no drugs that are helpful at all. But our wonderful, safe treatment is a low carbohydrate lifestyle. And studies have shown that not only does a low carb lifestyle reduce fatty liver, it actually reduces it almost immediately. Within days to weeks of adopting a low carbohydrate lifestyle, fatty liver can disappear. Indeed, it is pretty much the most satisfying part of my job, is seeing people with non-alcoholic fatty liver disease adopt a low-carb lifestyle, and within days to weeks, well, I never measure them within days, I certainly might measure them within weeks, all of their markers of liver inflammation are reducing. It's wonderful. It's amazing. I love it. A bit of instant gratification is good for us all. So how do you diagnose fatty liver? The most common screening test would be blood tests, where we look at the liver function tests, specifically the ALT and the GGT, and we want them and the AST, and ideally they should be below 20. Also, and if there is liver inflammation, it's really important to look for other causes of the liver disease, and that would include imaging the liver, such as a liver ultrasound. So it starts off with a simple blood test with your GP. All right, guys, I think I'll leave it there. I hope you have an absolutely wonderful day, and I'll see you again tomorrow. Bye now.